in the peritoneal space with drugs like Baytril is one of my favorites. Another favorite would be Nuflor, which is florfenicol, which I should talk to you a little bit about florfenicol injections. Those, on occasion, have caused a fish to become red. It's a vasculitis that occurs where the drug seems to have an adverse reaction with the blood vessels at the skin epidermis and causes the fish to become quite red and a little bit peely. The skin almost looks like it's beginning to peel. Those fish get better, but it takes weeks for that to subside. So some people are reticent to use Nuflor or florfenicol injections. Turns out, though, that when you use florfenicol by mouth in a new diet called Aquaflor, that side effect isn't seen. So it seems to have something to do with the florfenicol in the agent that it has been mixed in for injection purposes, and or the injection delivery system seems to cause that, what I call Nuflor scald, which is written up on my website, koivet.com. So I kind of think, in a nutshell, that covers an overview of ulcer disease in koi. You kind of get the idea that it starts with water quality and ends with improving water quality and clearing parasites that might be chewing on the fish. It goes to topical treatments on ulcers of any consequence, plus or minus injections of antibiotics to make sure that the germs die, whether the fish is eating or not. Baytril does work in very cold water. It just gets into the system slower, which is fine because the metabolism of the fish and the metabolism of the germs eating the fish is slow as well. Baytril is a slow motion actor in cold water, but so are the sores and so is the fish's metabolism. It works just about as effectively. It just works a lot more slowly. Some people say to put salt in the water with fish with ulcers, and that is absolutely true. If you have live plants, that might not be a great idea, and it's not necessary for recovery of the fish, but it does help. So if you don't have much in the way of live plants, or it's okay if those live plants take a dirt nap or get set back, a little yellowed. Some plants die right smack out like anacris, but other plants can handle it and they just turn yellow. Putting salt in the tank or the pond somewhere up to 0.3% is of help to the fish with ulcers. And 0.3% salt is accomplished with 3 pounds of salt per 100 gallons in the pond, or a tablespoon of salt per gallon in a hospital facility per gallon. Hopefully that'll pop up on the screen as well to avoid any confusion, because I might have misstated the teaspoon or tablespoon dosing. I can't remember what I said. That's what happens when you get old. So that would be kind of an overview of bacterial ulcer disease and ways to get those fish around that. If you're looking for resources on the availability or best place to get certain things, I would recommend or direct you to go to koivet.com/resources. Some things are really hard to find. Medicated food, which we didn't even talk about in this, and the reason being is medicated food in 2018 is not even available. FDA has regulated that completely out of business. So I don't know what to tell you about that. But if this is perhaps another summer, 2019 or 2020, whatever that you're watching this, you could go to koivet.com/resources and maybe find appropriate resources for things like injectable antibiotic supplies and or medicated food if it's out this year. So that's it. If you like this video, you would be doing me a big favor, as well as other people a big favor, if you like on it, because YouTube likes, and they bump things up, which means that it will show up when people search koi ulcer disease. So like on the video for the sake of other people. You can subscribe to the channel with notifications. Just subscribe, click the notifications, and I won't advertise to you and I will not bombard you with notifications. I appreciate it.